So my name is Melanie Ferris. I am a research manager here at Wilder Research. Wilder Research is the research arm within the Amherst H. Wilder Foundation in St. Paul, Minnesota. We're an operating, not a grant-making foundation. The mission of Wilder Research is to improve the lives of children, family, and communities through evaluation and research. And we do that by providing useful, high-quality research that's nonpartisan, that can really drive decisions, help organizations be as effective as they can in their work, and help them be able to demonstrate the value and impact of their work. So Wilder Research is, we have a staff of about 100 research staff. We do research in a variety of topics, from education, homelessness, education, early childhood. The areas that I do most of my work in are in the areas of health and children's mental health. We do a lot of our work here in the Twin Cities in Minnesota and across the state, and then we also do work in other parts of the country. We work in partnership with a number of community nonprofits and organizations, and also do work that is funded through various state agencies or different foundations, as well as some federal programs. So one of the initiatives that I've been working to evaluate is one that's funded through the Center for Prevention at Blue Cross and Blue Shield of Minnesota. The initiative is their Health Equity and Prevention Initiative. It's a 5-year initiative, and through that they've funded 13 organizations to advance health equity using policy, systems, and environmental changes. And a really important and critical component of all of their work has been community engagement. And so about halfway through the initiative, we asked representatives from each of the funded organizations to come together and really talk about, what community engagement is, how they use it in their work, and to help us develop a list of tips and strategies about authentic community engagement and how that can be used to advance health equity, including some of the challenges that they have faced along the way. And so through that conversation, they identified really 7 key ingredients. And the first one is that it's all about relationships. And it's important that when working with community members, that community members really are seen as partners in the work, not clients to be served. And that it's really critical to be able to come together regularly and recognizing that it takes time and a lot of one-on-one conversations to really build those relationships. Another key ingredient that they talked about is how critical it is to be transparent in goals and expectations. So a lot of times a funder might have outcomes that a program is required to report on, and so as an organization is really trying to work in community, the importance of that transparency and kind of the parameters where they're doing their work and how much influence then community members can have in shaping that work and driving recommendations and developing solutions that they really believe in and they can bring to the table. Another ingredient is really being able to listen to understand. And that means not just listening at events that they're hosting and asking community members to come to, but being present at community events and in other spaces to take the time to get to know the existing community leaders and understanding the community's history, and also being attentive to culture and recognizing that the organization may need to do a lot of their own work in order to be able to be more culturally competent in their work and develop those skills. Another important point that they brought up is the importance of fostering community capacity. So both recognizing the expertise, the leadership, and the capacity that already exists within communities, and then also being really intentional about how they're supporting other community organizations in that work and creating opportunities for leadership. And then other things that they talked about were the importance of having activities that bring people together in a variety of ways, making sure that all work is mutually beneficial, and that there's opportunities to keep coming back and checking to make sure that it is. And also that it's important to be aware of their own organizational capacity, so that as they are able to work in closer partnership, that they're able to respond to the needs and priorities of community members, and that they're mindful of how much work that they're trying to do in community spaces, and aware of their own limitations and how they need to address that as an organization. Community engagement, the organization's described as a long-term process where community members are really partners in identifying action steps that can be improved to improve health. And it's different than just asking for community input into maybe a decision that has already been made, or a program that's already underway, or doing community outreach or community education, where it's about kind of a one-way communication out to community, but really engaging community and being able to shape ideas, to set the agenda, to identify the priorities and move work forward. I think in some of my work, community engagement has been a word that's used so broadly that in some spaces it's lost its meaning a bit. It doesn't mean just any interaction with community members. It's with the intent of it being a long-term relationship where community members are partners at the table. So with the organizations that we've had the opportunity to work with, some of the challenges that they identified was just having adequate time and resources. And that includes their own time and what their staff how much time their staff can put into being present in community conversations and being attentive to relationships. But sometimes it's also dictated by timelines related to funding and resources that are available there. So that's always a challenge. Some organizations talked about the difficulty of attracting and retaining staff, particularly staff that really reflect the communities where they're trying to do their work. And so, some of the strategies that they've used to address that are some changes in hiring practices, also making sure that they're offering a lot of professional development opportunities and opportunities for leadership, really so that they can continue to retain staff and be able to see them grow into whatever new roles. Other challenges include just finding the right level of involvement for community members who are highly involved as advocates within their community. It happens here, and I'm sure it happens in a number of different places, that there are strong community leaders that are asked to participate in multiple boards and different initiatives, and the voice and perspectives that they bring to those conversations, it's important and critical, and yet they can be spread so thin. And so, a challenge and a responsibility of community organizations is to think about how they can, best engage with community members to the extent that they can and want to be involved in any kind of partnership. For these organizations that are working to advance health equity by changing systems and policies, some of the organizations really did a shift in their work to move from implementing programs or thinking about individual services to really moving towards engaging community members in developing ideas for policy change, and then working in more of that advocacy for policy. So that's just a shift in capacity, it's a shift in skills needed to be able to do that kind of work. And then the last challenge that they identified was just the challenge of being able to let go and to be able to share power with community members, knowing that maybe where they thought the initiative would lead will go in a different turn when they're actually working in true partnership with community members, and being able to let go of the agenda and really let community members drive it. The organizations that we worked with, they really focused on three things. One is that the organization has a really clear mission that places health equity and racial equity right in the center. And doing that can be a touch point for all of their work and lead to changes in how they think about hiring, the timelines for their work, how they allocate their own resources. And so that's one critical piece. They talked about the importance of really making strategic decisions and staying true to looking for mutually beneficial decisions and strategies and solutions, which might mean that there are trade-offs for the organization themselves, but it's important for their long-term work in partnership with community and advancing health equity. And then some of the organizations also just talked about the importance of providing training, both to new staff that they hire and thinking about ongoing professional development opportunities, but also thinking about training for board members. So if the board isn't familiar with racial equity or health equity and what that actually means in terms of changing how the organization approaches its work and operates, that training is really important so that the board and all staff are working in step. The organizations that we talked to, again, focused on a lot of those key ingredients that I talked about at the beginning. But in order to think about using community engagement to advance health equity, so much of what they talked about is just the importance of building those trusting relationships and recognizing that there's a lot of time that's needed to get to a point where community members and organizations have that vision for what it means, in this community, in this neighborhood, to advance health equity and work together on shared strategies. And so not to just a lot of the work that I've done, that a number of us have done in the office, we've also been thinking about what does it mean to think about community engagement in evaluation. So we've been developing this community engagement and evaluation continuum that we've been using in our work with clients so that we're able to really ask, are you really wanting this project to be a community-driven project? Are you setting it up in a way that it really can be? Or are you really asking, community just to give input to some decisions that you've already made? Or you want community members to be collaborators, but this kind of continuum has helped us really help clients or funders be more transparent in any parameters that they're actually putting around community involvement. And we've also then been reflecting about ways that we as researchers and evaluators can think about opportunities for community engagement in all steps of any project, from defining the questions to thinking through the interpretation of data and how it's reported. And our ability to, do community engaged research varies project by project. But one thing that we're really thinking about and committed to as an organization is thinking about how we can always be looking for opportunities for more community engagement and challenging ourselves to think about ways that that can ground all of our work. And I always think about research in terms of it provides data that can drive decisions, right? So when research is done in a way that it is done to community, then community members can't benefit from it. When it's done in a way that it is really trying to elevate the needs, interests, and priorities of community members, then that data becomes a tool that community members can use to advocate, to, data can be a complement to the stories and the narratives and all the other ways that community members are already heavily invested in advocating for the changes that they want to see in their communities. We do a number of community health needs assessments and other types of studies that are really trying to understand what the priorities of community members are. And so, again, it's just another way in that case of really elevating and in some ways kind of amplifying the voice and the priorities of community members. Make sure to allow enough time and to go at the pace of the community and not at the pace of the funding, which can be difficult to do for organizations. They talked again about just the importance of using multiple approaches, knowing that every community is diverse, and so there's a variety of ways that people want to be engaged and feel that they're best able to participate, and just being aware of that, and also knowing that the concepts of health equity are things that need to be kind of talked through, and that there needs to be some shared language and shared understanding around that. And then the other thing that they brought up, and I think this kind of builds on that foundation of having trusting relationships, is that it's important that the relationship is in place early on so that the community organization knows the needs and priorities of community members, that there's already that trusting relationship so that everyone knows that they're going to be working towards mutually beneficial solutions. But the organization really knows then what the community is interested in, so when this funding opportunity comes along, it's in alignment with where the organization and their community partners would already want to be headed, rather than kind of reaching out for the funding and then trying to engage people around it. This article is available on our website, which is www.wilderresearch.org. And on our website, we have a number of other summaries from the evaluation of this initiative and other projects that focus on health equity, as well as a number of other reports and summaries on a variety of projects.